Right, good morning, everybody. Thanks for those who are very prompt and have already joined. I'm just going to give people about 30 seconds more to join, and then we'll kick off the webinar. Right, I think we will make a start. So welcome everybody to our webinar this morning on genetics and protection. For anyone who doesn't know me, I'm Tim Smith and I'm Head of Protection here at Hannover in the UK. Now, advances in genetics is something that the industry talks about quite a lot, but it's generally seen as a threat for us. The potential asymmetry of information coming from people knowing more about their genetic makeup than we do potentially allows anti-selection, and this is something that's had a fair amount of comment in the industry. And it's certainly a challenge for us and something that we will need to address and tackle head on in the future. However, we think there may also be positive potential for the industry from advances in genetics. And over the last year, Hannover Re has been working with GenePlanet to investigate this potential, to understand the scope of genetic testing as it stands today, and possible applications for engaging with policyholders and potentially improving their health as well. So what we have for you today is 3 short sessions. Paul Edwards, who is an underwriting research and systems development manager here at Hannover Re, will give an introduction to genetics and its interaction with insurance. We'll then be joined by Matiesh from GenePlanet. They are a European company specializing in preventative genetic testing, and they focus on the interactions between genetics and lifestyle and the impact that this can have on long-term health. So Matiesh will give some insight into the capabilities of their tests and the insights that users can expect and the tailored advice that they receive as a result. We'll then be joined by Lisa Balboa, who is the head of Hannover Re's Life and Health Digital Business Accelerator. And she focuses on innovation at a global level. And Lisa, Matiesh and I will discuss the pilot that we've run and what we've learned from it, and some of the wider opportunities that we see for genetics in the protection market. Now, we will have time for your questions as we go through, so please do drop them as a Q&A functionality in Teams. So please drop any questions you have in there and we'll try and address them during the session. So first of all, I will hand over to Paul to introduce the topic more widely.
Good morning, everybody. So just a couple of slides from me just to provide an overview and a reminder of a few bits and pieces related to genetics and genomics before I hand over to Matiesh to talk a little bit more about what GenePlanet do. So just a quick reminder of some terms that when we're talking about this particular field. Generally speaking, when we're talking about genetics or genes, we usually mean about the interaction or the interplay of a single gene. And particularly from our particular field, the increasing discussion about what we mean by predictive and diagnostic tests and that sort of thing. When we generally speak about the genome or genomics, which is the more preferred term in the modern sense, but we're looking about the entirety of the genetics, all the genes that are within the human body, and then obviously their interaction and that sort of thing. And increasingly, there's the differences in little minute differences within our genome and how that interplays with things like disease manifestation and interaction with things like treatment as things emerge. Other things that increasingly are in the public domain and discussion are all the other omics, proteomics, metabolic omics, and so forth. The list is increasingly being added to over time. Again, 99. Well, we share around about 99.9% of our genetic makeup. Between you and me, and that sort of thing. The humans have around about 22,000 genes. This is discovered as a result of the Human Genome Project. But increasingly, what we're interested in is obviously the differences between us all, the interplay between specific, very small differences that can then manifest itself in what overall. And as the statistics show that most of us do have on average about 3 million differences in their DNA. No topic about genetics would be should miss discussion about what's made up of genetics, of course, and that's DNA itself, which are obviously made up of the 4 fundamental bases here. What I like to talk is one analogy I like to talk about is effectively what we're talking about here is that if the human lifespan could be attributable similar to a movie or a film or something like that, then the cells within the human body could be seen as actors and actresses, but the DNA could be seen as the script. But obviously genes are not the only thing. Genes are one aspect of things that could lead to disease manifestation, or the phenotype as it's called. Most importantly, when we're talking about genes, is the interplay with things like the environment and habits and so forth. And that's the most important thing there. Also, if we have a faulty gene in comparison to other people, what we need to think about as well overall is how often the phenotype or the manifestation of the faulty gene is manifesting itself. And then you talk about things like gene penetration and so forth. The nice one particular quote that I'd like to use sometimes is this one by Francis Collins, and that's that your genes load the gun, but the environment pulls the trigger. So these are all the important interactions that we need to take into consideration when we're talking about genetics. The other thing to mention as well is what can we use in terms of our particular industry, and there are a variety of different approaches related to this with our specific industry. The UK sits in terms of some self-regulation. We're one of the first markets, as probably many of you know, that introduced a genetic moratorium, or the code as it's now referred to, in the early 90s, which relates to how and when we can use genetic information and what particular genetic tests we can use. As you all are probably aware, there is some assured limit that when we can use genetics, and currently the only one we're permitted to use, of course, is Huntington's. But across the globe, there are differences of approaches, completely different approaches, with the majority of markets operating similarly to the UK. But at the far end of the scale, other legislations have taken a completely different view. For example, in Canada, which has recently brought in a federal law prohibiting the use of genetics in insurance. The code itself has been recently reviewed, and it's worthwhile noting that the ABI and the Department of Health and Social Care has just issued a call for evidence to the market and interested parties. So please, if you want to participate in that call for evidence, please have a look on the ABI site as well. So what does this mean for us all before I hand over to Maciej? Well, as the industry, the technology is increasingly becoming utilized, we're coming to understand a little bit more and more as time emerges. So as Tim's alluded to, there are some issues for us in terms of knowledge asymmetry that we need to be aware of. There could be some threats to some of the product lines that we've got. But nonetheless, we at Hannover firmly believe that this new technology is also an opportunity for us to look into ways and products that we can innovate on and provide value to for potential clients and so forth. Just another thing, a little internal a note. At Hannover UK, we do have our own underwriting manual, and we've got a specific section on genomics and genetics if you were interested in getting access to that. And that's me, and I'll hand over to the next speaker.
Thank you very much, Paul. Thank you for the nice introduction into the topic of genetics. Short introduction from my end. My name is Matjaž Petrović, VP of Sales at GenePlanet. And what we strive to do together with Hannover Re in a pilot project was to actually discover in more depth, the area specifically about preventative genetic testing, how this can actually also be used positively in the insurance setting, because we firmly believe that genetics is not gonna go anywhere. Also, insurance is gonna be here and stay. And let's not only talk about the potential pitfalls or limitations, but also what are the opportunities. And to start off, let me also share a little bit what the participants at Hannover Re actually experienced through a short walkthrough about the demo about our solution. And I'll do this basically through my own results. What we do at GenePlanet is combining, let's say, DNA testing also with current status insights, because we believe that who we are today and who we're going to be in the future, like Paul already mentioned, is a combination of genetics, the predispositions, which we were given at birth, and then the other thing, the habits, the environment, which we are influencing on a day-to-day basis. And this combination actually results in who we are today, who we're going to be in 5 years. So through genetics, we actually want to incentivize people making positive lifestyle choices that can, in turn, improve their health and their well-being in the long term. Now, when it comes to the DNA testing part, there's different types of DNA tests. There's clinical testing, there's diagnostic testing. But as I said, we focus mainly on preventive testing, where we have two main products, My Lifestyle and My Health. And the My Lifestyle one is actually the one mostly used by our insurance partners. So we do already partner with different insurance partners for a number of years. Companies like Generali, Unica, and so on. And in the My Lifestyle part, we essentially have a pure focus on items which are not related to diseases. Things like diet and nutrition, sports and recreation, and body and mind. Now, what we do here is actually test the individual genetic makeup for each individual. And if we go to a certain segment, let's say body and mind, we have different things related to sleep, skin hydration, and so on. And we immediately see that with different colors, we identify something which is maybe not the best for the individual, something which is, let's say, more average, or something which is more positive than the average. So immediately, in a simple way, we highlight the items where by making changes, we can actually make the biggest progress. Now, one of the items which we added, let's say, a couple of months ago, was some items related to tanning response, sunspots, and so on. And this is, let's say, my personal result, which I received a couple of months ago in terms of tanning response. Having an explanation or a clear, simple results from a user perspective. And key is also the recommendations. And like I said, even if we have something positive genetically, the outcome will be a combination of adding the lifestyle factors next to it. And although I have a good result, I still have recommendations, what are the risk factors for sunburn, how to treat sunburns, products to soothe it, and so on and so on. So this is the same principle. If somebody would have a different result, also recommendations are then different. Often our clients and customers also ask us, but how is this possible? How do you actually determine this? And like Paul mentioned, the science of genetics is something established, something which is also growing. What we do as a company for more than 15 years is that with full transparency, we actually show the raw genetic data for the individual which was analyzed. So the specific markers on our genome which are related to this. We also transparently show the scientific background about the scientific studies. So it's not something that only we at GenePlanet would discover, but we're actually curating all the knowledge which is out there from Harvard, the University of Berlin, from China, and so on, into a unique set of meta-studies, replicated studies, and so on. So people can transparently also check which scientists discover something in this area with multiple links directly going to this. So we have here, for example, Visconti and other on a study of 176,000 Europeans, and the next one, and the next one, so on. This area, like we said, is key. What we do in terms of environment always have the impact. So in our tests, we only test for items which we can influence with our behavior. So we're not just saying, look, this is something genetically and you cannot do something about it, but everything we test has an environmental component, and this is where we want to lead people to in terms of these recommendations. And we also then make recommendations, interesting facts, and so on. Now, the My Lifestyle part, like I mentioned, is something which we most usually do with insurance partners, having sports, having also the diet stuff and this. And together with the pilot for Hannover Re, this is also something which we said, let's everyone in the group use it. But then we also have a set of tests, which is called My Health, which is then dealing a little bit more with diseases, basically polygenic risk scoring around cancer, around cardiovascular diseases, and also immunity. A positive thing was that once we presented this as an option, almost all participants actually also decided to also opt in for the My Health part. Showing also again a little bit my own results. So when it comes, let's say, to polygenic risk scoring related to cancer, there's different cancer types which we have included, and the list will be growing in the future. And we see that, for some items I actually have a lower risk than the average person. But for some things, I have a higher risk. So looking, let's say, at my personal colorectal results, I have a risk which is, let's say, 130% increased from the average. But then I have also additional information what this actually means in terms of a lifetime absolute risk, meaning that my lifetime risk is around 13%, growing from the average of 6. What is also important is the 5-year risk. Based on my current age of 44, my 5-year risk for the upcoming future is still at 0.3%. And from the charts and graphs, we see that this will also grow in the future. Now, what we want to do is, like I said, be in the point of prevention, but also early detection. So again, for colorectal cancer, explanation that essentially if I will have a bad lifestyle habit, this is even a higher risk factor than the actual polygenic risk score, which is also here. And here, explanations, recommendations, what will either positively influence my environment or negatively add onto my risk loading. And also explanation in terms of early detection. So for example, throughout Europe, it's generally recommended to take a colorectal screening test at the age of 50. Due to my increased risk, we have shifted this and say, look, it would make sense to do a first screening test around the age of 44, explaining what type of screenings there are, like colonoscopy, sigmoidoscopy, colonography, fecal-based screening tests, and so on, and additional links to guidelines for patients and so on. And this is, let's say, the genetic part, which we do, but we also want to follow up with clients on the current status. So this is why we also included in our platform, in the application, also a so-called health score calculation, which is now working without DNA data. What we want to do here is actually understand where the person is today, what are the lifestyle factors positively or negatively influencing his risks, and what he or she should focus on in the current moment. So this is now again my data. So I have a currently quite good health score, but it's been moving up and down in the last couple of months. So it was at, I don't know, 800, went down to 730. Now it recently went up again. And if I have a look at the elements which are here, we have, I don't know, smoking. I never smoked. I have a good resting heart rate, sleep well. In terms of steps, it's connected also to my wearable device. So I have tracking for the last 3 months, 1 year, and so on. So we can actually check what are the elements. But if I go, let's say, and here again, recommendations and stuff like this. But if I go again to what I can improve, I have a slightly higher BMI. I have too much stress. The alcohol consumption, I'm gonna, skip quickly. You did not see this. But another interesting thing is, let's say, my LDL, which is also connected to another functionality, which was part of the platform and the experience of the pilot. So we also included, let's say, a blood biomarker interpretation layer, where we actually curate all the results, explain, for example, what is LDL, how does it affect health, how can we manage it, so acting like an encyclopedia. But basically also to the standard lab results, we do provide specific recommendations. And this is also my personal story. 5 years ago, my doctor told me, do you want to have like a preventive health check? I said, great, of course, I would like to do this. She sent me to the lab. I came back. She said, look, you're a perfect human being. Everything is great. I said, thank you, doctor. Really nice to hear. And then last year, she told me again, go to the lab, come back. And all of a sudden, last year on the 15th of April, my cholesterol was at 4.3, which was already in a clinically relevant level that essentially slowly I would need some medication. She said, look, since it's the first time, we're still going to monitor this. And this year, she sent me back for another checkup, and I managed to decrease my LDL levels down to 3.9. So this is another functionality of history tracking about the results and highlighting also this, but here we want to be completely in a preventive manner as well, because if something is elevated or close to a clinical level, our recommendation is always, go and consult with your doctor, but we still on top provide recommendations, how to manage this, how to improve this, how to, do a certain element in a preventive way. And the whole aim of the platform of genetics and blood is to identify where we are in terms of our differences, where we are in terms of our needs, and properly manage, notify, and keep people updated about this, and also through their progress. This would be a short demo, and now I'm handing over the word back again to Tim for a follow-up discussion about some of the pilot experience.
Great, thank you. Good, so the plan now is that we're going to have a discussion to give some insights into the pilot that we went through. So this was a pilot that involved around 50 to 60 staff at Hannover trying out the technology, understanding what insights we could get, and throughout the whole process, feeding back on the experience, how useful various things were, and I guess as insiders in this industry, how we thought it was applicable to protection. So, Maciej, perhaps I could start with you. So, I mean, the pilot study was designed between our organisations, but we're certainly led by your expertise and experience, given the work you've done with insurers in the past. Perhaps you could give us some insight or just make some comments about the journey that Hannover staff went on during this pilot, what was in scope and what were the key elements?
Yeah, sure thing. Basically, what we wanted to do is, via an internal pilot, also get two things, the personal experience of participants being exposed and testing themselves a certain set of DNA tests. Because, there is different test types out there, and if I just say, let's put DNA next to insurance, 50% of people will immediately get scared, 50% will get, yeah, let's do it. So I think it's important to really have a personal experience. This was one of the aims. And the other thing was, really then have industry experts look at it from an industry perspective. What are the benefits? What is the potential? How could this be actually implemented in a positive way to actually create a win-win situation? How can we create a win situation for the insured? How can we create a win situation also for the insurance company? And the pilot was a 6-month pilot where we provided everyone with the My Lifestyle DNA test, like I said, on purpose, nutrition, sports, no diseases included. Optional opt-in for the My Health part, which is dealing with the polygenic risk scoring risk for cardiovascular and cancer diseases. And on top of that, we also, for the UK branch, provided some blood testing to also measure, let's say, the progress between the start of the pilot and the end of the pilot. And all the participants had access to the application. We also measured, how they're using it, how frequently they're using it, because for us, it's also important not to do it just once, but also keep a momentum. Here, maybe just one piece of information. We are, from last year, basically one of the first companies in the global market using so-called whole genome sequencing technology, which allows us also to provide new insights and new results and new analysis on a constant basis when new scientific discoveries happen. And we saw that this is one of the strong engagement points where people then also return to the ecosystem, to redo their health scores, to also look at their new results, previous results, and so on. And Lisa, you were one of the participants, and maybe you can also share your story a little bit, how you experienced the program.
Yeah, happy to, Matthias. So I hadn't done this sort of testing together with the blood testing before. So it was that kind of combination of the genetic testing together with the blood testing that I was particularly interested to try out. So it was actually a very good experience. So Matthias came to the office and launched the pilot and gave everyone their DNA kit. And it was quite simple to make the test. So it's just spitting in a tube. I think finding a quiet corner for that helped, or people could take it home and kind of bring it back the next day. We also arranged for kits to be posted to people that couldn't make it into the office, or for some of the global colleagues that participated as well. So logistically, it was quite easy. Participants had a very good experience with that, similar to me. I think more than 90% found it a very easy process. So that was great. And then whilst the results were being analysed, that's when we got set up with the health score. So starting to track things like the physical activity, or filling in those different measures in the circle that Matthias shared earlier. So things like the blood pressure and other scores. And then there was quite a lot of anticipation for the first results. So the first results shared were the nutrition insights. So there was, a lot of different information there. I think one that stood out to me was that I was likely to be lactose intolerant, which I hadn't have been aware of before. So that was particularly interesting. So I had the coaching session, and it was very much because it's that combination of genes and environment. It's not to say I would definitely be lactose intolerant, but I decided to cut out dairy for 1 month. And actually by doing that, I felt a lot healthier. And also, interestingly, from the first blood test, I'd had a high cholesterol that came back from that first blood test. So actually by cutting out dairy, I think it brought my cholesterol back into normal lines as well by the time of that second blood test. So it was great to see, just in the space of a couple of months, that actionable change in my cholesterol, just from making one small tangible change. There's a lot of different information that's out there, but really making sure to focus in on those that can have sort of the most impact for me as an individual, for participants. That's really the key. There's a lot of information. So the coaching and the guidance, or just taking the time to look through the results, that was really great. So I think there's a lot to take away from that diet and nutrition chapter as well.
Yeah, I mean, I would definitely second that. So I took part in the pilot as well, as you probably would expect. And certainly, it was that coaching element that I found very useful. So having somebody explain the results to you. And I think the personalized nature of the results then really comes through. So you obviously everybody knows certain things they could do, you know, drink less alcohol, eat more healthily, do a bit more exercise, that would probably improve their health. But, you know, if you're told, actually, given your genetic makeup, if you make, you know, these are the 3 most valuable things that you can do. These are the small changes potentially that you could make that are going to have the biggest impact. And I think it's that probably has the potential here for me. So I think, you know, I guess if we think to our industry, policyholders probably don't want their insurance companies lecturing them with do this, do that, where it seems sort of very generic advice. But if they can give very specific and targeted insights, then maybe that will be far more appreciated. I mean, in terms of the sort of findings and particularly the user engagement and things, maybe Lisa or Matthias, you can give some insight into the sort of levels of engagement we saw.
Yeah, for sure, it was a higher uptake than we expected. So we wanted at least 40 participants, and there was some healthy skepticism as to whether we'd find 40 people within our branch of 70 to take this up. But yeah, we had more than 60 participants in the end, sort of including requests from different senior managers in other offices to participate as well. So GenePlanet were very accommodating to that, to allow sort of experts in a few different countries to also participate. So I think it was really good. It generated a lot of discussion in the office, like the analyses, like who's a better metabolizer of alcohol or caffeine. That's quite a really useful insight, right? Cutting out caffeine in the afternoon. Fortunately, I don't need to do that, but quite a lot of people do, versus the alcohol, where I'm just a bad metabolizer of alcohol. So knowing to cut back on that, that was great. There was very good engagement when those results came out.
Yeah, maybe just to add a couple of words here, you know, on the engagement. So also for us, like I said, it's important to keep the people, you know, in the app and in the ecosystem. And during the pilot, we actually had 83% retention on monthly active users. And if we look also at the weekly stickiness level, it was above 50%, meaning that, you know, those clients were returning also on a weekly level. I mean, we don't promise as a solution like a day-to-day high-end engagement tool, because we also believe that this is, let's say, short-lived in many instances. But the aim is really to keep clients for a long time, identify the right things, and, you know, act upon them, and, you know, support the people also with reminders around this, you know. And Lisa, also what you mentioned, you know, what you discover, this is also something which we frequently get from clients, you know. They say, I always thought this is something which is potentially something. I always thought that this will make me problems. And once they get the results and dig a little bit deeper, you know, then they actually see that this is something which is really something they should change. And would be great if they have also changed it earlier, you know. One example is my wife, you know, she was tired for years, had problems, you know, with low energy and stuff like this. And the doctor discovered eventually that she's really low on iron, you know, and that really she has to supplement, has to change several items. And once she got the DNA test, you know, it also showed a poor metabolism of iron, you know. And if she knew this, I don't know, 5 years ago, 10 years ago, she could have acted sooner in a specific way, as opposed to waiting and checking, you know, not even going to the doctor saying, look, I mean, I'm tired, it's normal. But then you have a certain direction which you can quicker come to a certain solution of a potential problem.
I think that combination is really valuable. There were quite a few that came up for me, like a lot of B vitamins, where I'm a poor metabolizer, but I could actually see from the blood test I wasn't deficient in those. So I took a lot of comfort in that. It's also one to keep a track of, right? So when I do blood tests in the future, to try and see if I can also get those ones tested, to make sure that it doesn't suddenly swing the other way, I think is great. It really shows the value of combining sort of the genetics. It's something to look out for, and then also things like the blood testing to make sure, you know, whether or not that's been adapted through diet already for people.
Yep. And what was also good, you know, that, you know, on the feedback of the survey, you know, 90% actually found the recommendations useful. 50% of your group actually made changes after receiving the results. And from our other corporations, this can be as high as, I don't know, 70% or 75% of participants. So this personalization aspect, which Tim, you also mentioned, you know, once you get your own results, you do look at it differently, start acting sooner. And there is also independent studies which are showing that this is like an effect that genetic testing can actually have on the individual to start acting
And touching then on the sort of ongoing engagement, because I guess that's an area that's always a challenge. Well, in any industry, but certainly in the protection industry, people might be engaged on day one, but that will drop off quickly. I guess one of the things that I suppose I hadn't probably fully appreciated before the pilot was the ongoing nature of the advice that you can give. So once you have your full genome sequenced, and I guess this is where not all genetic tests are born equal. So some quite high profile ones only look at very certain parts of the genome. But when you have full genome sequencing, then once that data's there, it's just there. It's sitting there on a database. And as new discoveries are made, then potentially you can gain new insights without having to be retested. And that was something that was obviously provided throughout the pilot and is an ongoing service that GenePlanet do. So I think that's a really valuable way of continuing to engage with people, actually, if you're continuing to provide genuine new insights in a very passive way, without them having to actively do anything to get those. In terms of the insurance applicability of all of this, then maybe you could both comment. Obviously, Matthias, I'm aware that you've worked with insurers in the past, so maybe you could give some insight into what's been particularly valuable there. And Lisa, maybe you can comment from your experience in the pilot, how you would see this, maybe from a UK point of view, sitting within the UK protection market.
Yeah, certainly. Like I said, we've been active also in the insurance industry now for a couple of years. The first beginnings were tough because, it's hard to convince the first partner. But then once we started, they actually saw that this can really be something positive as part of offer, especially together with life, health, or protection policies. This is why, we in general add the service as a value-added benefit. Often we also, let's say, try to enhance the insurance story, because insurance traditionally is about, taking care of the person if something bad happens to them. We want to bring a preventive element into the whole package and providing a preventive tool regardless of a claim. So this is what we do, combining our services together with term life, with health insurance policies, with critical illness, also with accident, in order to achieve multiple things. We want, in a way, to have a positive market differentiator, which acts as a sales tool. And one of the questions was whether this can influence also sales in the pilot, and there was really good feedback on that. We also want to enhance the touch points and the experience in terms of engagement and persistency of the portfolio. And especially also for the future, here where we want to actually work closer together with insurers and also reinsurers, is further exploring the claim cost reduction aspect. Because definitely, improving the behavior of people in terms of lifestyle can result in claim costs in the future. And this is something which, as a third pillar, we had actually strive for.
Yeah, and I think to me, it's that preventative healthcare angle. I mean, the new business, the persistency is very important. We did ask a question to the participants around, would it have the potential to decrease claims costs? So on a product like critical illness, 65% saw potential to decrease claims cost. And that's really coming from those health insights, which we haven't spoken much about so far, but actually, despite making it optional, pretty much all but one or two people did opt for those health insights. So that's things like the cancer risk. So for me, it was the skin type cancers that came up as the highest risk. So knowing that, there's actionable steps that can be taken there, right? To make sure that I, use a higher factor suntan cream. I keep an eye on changes in my skin. So that's a really tangible way where you could see there could be very clear preventative steps that people could take or be supported to have the choice to take, armed with those insights in terms of what that higher cancer risk score is, or even cardiovascular risk score as well is part of that. So I think working through with the insurer, how could this be integrated as part of a holistic proposition? So if people get these different insights into their health, how can that be presented in a way that people can then take those actionable next steps if they want to help manage those risks, both on the health side and also the diet and nutrition side when it comes to chronic disease risks as well.
Good. Thank you. So we have a question in from the chat, and just to remind everybody, there is a Q&A functionality. So if anyone has any questions they'd like to pose, we've only got about 5 minutes left, but we will try to address some. So there was a question in the chat around whether pilot participants received any concerning information that needed to be acted on immediately, and if so, I guess what lessons might this provide for insurers thinking about offering this to their clients? So I guess I would just kick that one off by saying, actually, I've got no idea, and that's quite an important point here. So data protection and privacy, this is very sensitive medical information, and one of the challenges I think we have as an industry in implementing technology like this is reassuring policyholders that there is sort of protection for them in place and good data protection, and making it clear that that everything is extremely confidential. So I don't know exactly what was discovered, but I guess you do have that potential that somebody does find something out that they're really at a very significantly elevated risk of something that they had absolutely no awareness of. Matthias, I don't know if you would like to comment on that as a sort of services and support that would be provided.
Sure. And then maybe let's start with the data privacy and protection issue. So this is definitely a key topic, and as a company, this is something which we really focus on. We also have ISO 27001 in terms of a standard for this area. And one key maybe also to highlight, to the participants and listeners, we are not sharing the results with the reinsurers or insurance company. So this is one aspect which Paul was mentioning about the, let's call it the moratorium in the UK and some other countries. The whole point is not, to share the results for underwriting purposes, but rather, to identify the people, what they can change, and leading to a better outcome for all the participants in the story. In terms of the results, I cannot be specific, but yeah, definitely, we saw that, for several items, people had follow-up consultations also with our experts, defining, let's say, additional steps. But one thing to mention is also that distinction between, let's say, diagnostic testing and predictive testing. So since this was not a diagnostic test, nobody could receive like information, yes, you already have cancer or something like this, which would be, let's say, a difficult story also to do in a digital environment like we provide. But it's rather identifying items one step ahead, and we have multiple customer stories who, similarly to Lisa, received, let's say, a higher risk score for, skin cancer and this, and said, okay, yeah, since I have a higher score, let me check it, let's explore it. And they actually came back to us saying, look, based on these results, I actually went to my GP, I actually did some further screening and was discovered with certain illnesses at an early stage, where otherwise, if I would not do this at this moment, maybe I would have waited 4 years, 5 years, when the situation would be totally different. So this is the whole aspect of prevention, which we try to foster, providing information in due time. People then, of course, can act upon it or not, but at least they have some additional guidance, what specifically to check for themselves, not just relying on the general information which is out there.
And you make a good point there. I suppose this was very much focused on prevention, not diagnosis. But there have been a lot of genetic advances on the diagnostic side as well. Lisa, I don't know if you want to comment on that. Are there any opportunities you see there for insurers?
Yeah, I think that's also a great opportunity. So it's a newer emerging field of science. So I guess we focus a lot around the preventative risks for things like cancer, but also if someone is diagnosed with cancer, there could be opportunities for insurers there as well. So I know, for example, in the US, there's been a product launch recently by HealthHome where they sort of supported that other end, right? So if someone's diagnosed with cancer, they can help to get that genetic test for the tumor and then guide that person through a navigation service to the right healthcare provider to get that right treatment for them or assess clinical trial eligibility. So there's great potential there across the spectrum, right? It's all about sort of linking in the preventative healthcare approach all the way through to thinking if someone is then diagnosed with something like cancer or cardiovascular disease in the future, what sort of insurance payouts could be there, what other support services could be there. So I think to really think through as an insurer, how do we support preventative healthcare And then also, you know, what else can be done when there's sort of claims that come along, and to support people. It can be a nice way to think about future product and proposition developments as well.
Great, thank you. So we're actually just about out of time there, so I think we'll wrap things up. Apologies if we didn't get to your question in the chat, but the good news is that the white paper will be published, that we've produced together with GenePlanet on Friday, and that will no doubt answer quite a lot of your questions. I would also stress that we'd love to come and talk to you about the research and the pilot. And so if anybody would like a follow-up session, then please do get in contact. I will just flash up our contact details on the screen now. So please do get in contact, or get in contact with your regular client relationship manager at Hannover Re, and we can certainly set up a follow-up. So look out for the white paper that should land this Friday into your inbox. Thank you very much for joining us today, and I hope you found it insightful. Thank you.
Thanks, Tim. Thanks, everyone.
Thank you.